Wonderful Monday. And we're honored to have in studio two very special guests. Jennie English, Development Director of Rapha Clinic of West Georgia, and Jacob Sudduth, President of the Emergency Care Leaders at the University of West Georgia. Good morning.
That would be emerging healthcare leaders.
What did I say?
Emergency.
Did
you were
I?
thinking about, we were talking about the emergency room.
All right. So we're like 15 seconds into the program. You've already corrected me one time. Okay, that's good.
Just had to do it.
Yeah, no, that's fine. I understand. So we'll keep going. But good morning. Good morning, Jacob.
Good morning.
I think we'll talk to him first. All right. But actually, we're here in large part because there's a special, important event for the Rapha Clinic. So why don't we start off with that? And then we'll kind of conclude with that in the program. Does that work for you?
Yeah.
Okay.
Yes.
And this thing's called The Sounds of Medicine.
It's called The Sound of Medicine, the brainchild of
Second mistake.
What?
Go ahead.
The brainchild and of our medical director and chairman of the board, Dr. Amy Eubanks, came up with this a few years back as a way to raise money for the Rapha Clinic, West Georgia. As you know,
she's a bass player.
She's a bass, yes. She's a rock star.
She's a rock star.
But really, she's a very talented musician, and what we've done is pulled together a number of musicians who are also physicians. Not everyone, of course, but we have. That was really the concept. And so let me just go ahead and tell you. So her band Redeemed, and we have the district attorney, Jack Browning, who's in that band playing also. So it could be The Sound of Medicine and Law. And Dr. Howard Seaman, who is a beloved gastroenterologist here, and he has the Dakota Dodge Band.
No GI guys are beloved. I just want to let you know.
They are. In my world, they are.
Oh, okay. All right.
And one of our board members, Bishop Sam Sauls Jr., who he's phenomenally talented. And so then we're going to have the Carroll Community Wind Ensemble, and Dr. Jonathan Gooden plays with them. And we have someone that nobody even knows, Dr. Jeanette Diaz from the University of West Georgia. She's got a group, an African drum group called 10 Blocks Away. And she's really one of the leaders for Healthy Harrelson, which is another incredible Tanner initiative. And she's bringing her group. And then we've got some of the Dr. Kids. Lexi Eubanks will be playing. She's the flute, and Eli Parrish on clarinet, and then the Larson's daughter Elise will also be playing. And it really is a wonderful evening, and it is right now. It's our major fundraiser.
All right, our guests this morning are Jennie English, Development Director of the Rapha Clinic of West Georgia, Jacob Sudduth, President of the Emergency Health Care Leaders at the UWG. You can join the conversation at 678-601-TALK, 678-601-8255, or you can join us on Facebook. We're streaming live on newstalk1330.com, and you can post a comment there, and we'll try to get it for you. All right, well, we got some kind of foundational business to go in. We need to, for those who don't know, need to learn a little bit more about Rapha and the Emergency Healthcare Leaders. So let's start out with that. For someone who's never heard of the Rapha Clinic of West Georgia, and there are a lot of people that haven't, tell us about it. What is it?
We are a nonprofit, faith-based, charitable medical and dental clinic. We've been around for about 8 years, and we're a ministry. We work to be the hands and feet of Christ, who said to care for those who are sick. And so we treat uninsured adults in Carroll, Harrelson, Hurd, Paulding, and Douglas who don't have insurance and who don't have the ability to pay for it. So it's really an amazing operation. Unfortunately, a lot of times when folks come to us, they really are sick because maybe they've been without health care, haven't seen a doctor in quite a while, so we treat a lot of chronic conditions. We have, see a lot of folks who have diabetes and hypertension. And in fact, right now, thanks to the Community Foundation, we're doing a diabetic management study, and where we have a nutritionist, and we have nurse practitioners, and we have staff who are working with folks to get their diabetes under control. We did it last year in our Bowden clinic. We have 2 clinics, Bowden and Temple. When we did it in Bowden, it was very successful. And so we, thank you, Community Foundation of West Georgia, we're doing it again.
What is the level of demand for your services at Rapha?
Well, last year we're not open every day. We'd like to be, but we're not. But last year we had about 2,020-something medical and dental visits and about 451 medical and dental patients. So right now we'll have to say our dental clinic, we have a waiting list right now. We actually have a waiting list of 100, so let me make an appeal right now. If you want to talk to your dentist or your hygienist, we have state-of-the-art equipment, wonderful staff, but we need more dental providers in order to stop that backlog. So we encourage people, when you're in there getting your teeth worked on next time, you just mention to your dentist, if we have dentists or dental hygienists giving us a half a day, just once a year, we could stop this and open it back up.
Jacob, you're a student at UWG, and I understand you intend to be a physician, but you're also president of this group on campus, so emerging healthcare leaders. Well, pre-med students coming together, or what's it all about?
Well, it's not just pre-med students, but it's anybody that's interested in going to the healthcare field, with the exception of nursing students, because they have a specific club that does something very similar to what we do. If you're interested in becoming a pharmacist, a dentist, PA, PT, basically what we do is we provide a little bit of direction for those students who are just coming in and are interested in the field but have no idea what really is entailed. So it's kind of like taking the underclassmen under your wing kind of thing. So we also offer different community service opportunities, and every spring we also do a fundraiser for the Rapha Clinic. It's called the Rapha Walk. It's a 5K. You don't actually have to run it. So yeah, that's kind of our general gist, but we like to do different things with different clubs also on campus and stuff like that.
Well, what drew y'all to supporting the Rapha Clinic?
Well, since we are a pre-health club, so to say, a pre-professional club on campus, we like to look in our own community and see where we can help the most. And if it's something that happens to be related to medicine, that's great and it's wonderful, because the more exposure we give these students to something that they may be interested in doing with their life, the better. You know, they have to see what medicine is actually about, not what they think it is from shows they see on TV. So that's why we looked for anything that in the local community, and we found the Rapha Clinic that way.
And this is their 3rd year of doing that, and it's been very successful.
All right, we're going to take a break, and appropriately enough, we're going to hear from Tanner Health System, and we're going to come back and talk a little more about the sound of medicine, and with Jacob and Jennie, after this word from Tanner Health System.
At Tanner, we're advancing health throughout West Georgia and East Alabama, because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
All right, welcome back to the Community Voice. We've got Jacob and Jennie in the studio today. Jennie English is Development Director of the Rapha Clinic of West Georgia. You can give us a call at 678-601-TALK, or you can find us on News Talk 1330 Facebook Live. And Jacob Sudduth is President of Emerging Healthcare Leaders at UWG. But we really want everybody to kind of keep in mind about the Sound of Medicine coming up Thursday night. Where's it going to be?
It's at Milltown, fabulous Milltown Music Hall, Thursday night.
Oh, they've added to the name, Fabulous Milltown Music Hall.
Yeah, very good.
Thank
March
you.
1st and from 6:30 to 9. But I have to tell you, and I want to thank Tanner, who is our top level sponsor. And we have many other, RK Reading and SMI and Bremen City Schools. And what's this? Graddick Communications, Bremen Primary Care. I just want to show you this. There's so many on here, I can hardly read it. How do I do this? I can hardly read all of them. But what that shows is the support from the community. Now, it's going to be... you really do need to, I'm going to give a phone number because we've got to make sure we've got tables and food for everybody. So people really need to call me by no later than tomorrow morning. And my number is 678-953-7877. That's 678-953-7877. And we're going to have the fabulous Josh McCorsley. He'll be doing his wonderful hors d'oeuvres and desserts, and it really is a great time. Now, you can get tickets at the door, but we are really encouraging people because this is filling up.
How much are tickets?
$20 and $25 at the door, and you can get a table. Table of 8's $250, table of 4 is $150, and it's not too late to be a sponsor. We have a level called Taste Bud that's everybody can afford. So just give me a call and see if you can come, and we'd love to have you.
Very good. And that starts at 6:30 Thursday evening?
It does, but yes.
But
we're encouraging people to get there a little earlier, 6:15, and check in and all that. And dresses, business casual, church, church dress, whatever you want to.
Okay, very good. Jacob, when you see and hear about an organization like the Rapha Clinic, obviously y'all are supportive, very supportive. I understand you've got a fun run type of 5K run that y'all do. Tell us a little more something about that.
Yes, sir. The Rapha Clinic is really it's inspired the club in a way that it shows us what medicine is truly all about. So we try to help out as much as we can. So every year we do the Rapha Walk. It's a 5K event that we held at Hobbs Farm. It's going to be April 14th this year. It's going to start at 11 a.m., but we're going to, sometime in the next couple of weeks, we're going to actually get a website up where you can actually pay for the event beforehand. And if you pay before the date, it's going to be $15 per person. If you wait till the day of, it'll be $20 per person. And I think last year we did... I think like the first 20 or 25 people got a shirt and stuff like that. Plus, if you happen to be a student at the University of West Georgia, your professor may actually offer some extra credit incentive if you go to this event. I remember I kind of helped get that rolling last year. So yeah, that's kind of the general gist of what the Rapha Walk is all about.
How should people contact you if they want to be supportive of it?
If they want to contact me, they can. I would say the best way to do it would be to email me. And my email is jsudduth1@my.westga.edu. That's jsudduth1, that's JSUDDUT1. That would be the best way to contact me. Or they can just, I don't know if they have any kind of access to OrgSync or anything like that, but if you're a student at West Georgia, you do. And they can just type in emerging healthcare leaders and find us that way.
And if they want to call my number, my cell phone, then they can call, and because as he said, that website will be up soon, and I'll direct them.
Well, what do you, and I hate to throw out, but I am very curious, Jacob, in this day and time in America, we've come through the controversial status of Obamacare, et cetera. Why would somebody young and wide-eyed like yourself and your colleagues there among this organization, why would you want to go into medicine, and why would you want to serve? Because there are a lot of question marks now about being a physician or being in the healthcare industry. What's the current thinking among you and your peers about wanting to serve as in healthcare?
There are a lot of questions, and it's a good point to bring up because it's definitely something to consider. However, for me, it's never been about the money per se. As long as I have, I can live comfortably, I'm okay with that. But yeah, that's a very good point, and it is a concern for a lot of students that are looking to go into this field. A lot of people ask about it. I can say for myself personally, I'm planning on going into the military, so I'm not going to have to deal with the red tape of the insurance, so to say. Not everybody I see will be covered, and
Sure.
it won't be as big of an issue as my civilian counterparts. So I haven't done as much research into it, but I did go to a conference that was held on the campus a couple months back, and it was pretty eye-opening. The statistics that we have for our insurance and against other developed countries, it's staggering, honestly. We spend the most, yet we have some of the worst outcomes, statistically speaking. And to me, that's just unacceptable. So I am aware that something needs to be done, and I hope that maybe someday I can be the change, help with the change in turning it into something that's better.
Now, you're a Bremen High School graduate, so what was there an experience in your life that inspired you to go into medicine?
I've always been interested in medicine, even from a young age. I wouldn't say that there was any one event that just sparked my interest. It's just I've always been adept at the sciences, and I've always had a very curious mind for the way things work, like medicines and so on and so forth. And so it's just kind of been there from the very beginning for me.
Interesting. Well, one more question for you, and then we'll switch on back to Jennie. But this organization on campus, how many members do you have? I don't think you mentioned that.
Yeah, we have roughly 300 members.
That many?
Yeah.
That's enormous.
However, we only meet on certain days of the month, and not everybody's able to attend every event, which
Sure.
is understandable. Everybody's college students in this club, and they all have busy lives, and I understand that.
Generally, I think we all have the connotation that physicians and nurses are very studious, very dedicated. Is that still the case?
In my case, I can say yes. I would say for most of them that will be successful, I would still say yes. In general, at the undergraduate level, I would say that probably not, but they're learning.
Very good.
And I've been meeting with that group about the last year on and off, and I have been so impressed with the caliber of these students. And they did a thing on how to be successful the other night. Of course, I was taking a few notes. I'll be glad to send them to you.
Thank you.
And I can study them as
right.
older people.
Thank
but
you.
it was really, these are great students.
Well, I know that means a lot for Rapha to have young people to come, because a nonprofit world is a challenging world, and to have university students actively supporting you is pretty phenomenal in a way.
It really is.
So,
it really is.
All right. Well, let's take another break. We'll be back with more with Jacob and Jennie. We're talking about the Rapha Clinic, the Sound of Medicine, coming up Thursday night, and the emerging healthcare leaders of University of West Georgia. We'll be back with more after this.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
But do want to
Okay, thank you very much. Welcome back to the Community Voice. I'm Steve Gradick, your host. You can give us a call, 678-601-TALK, and we have in studio Jacob Sudduth, President of Emerging Healthcare Leaders at the University of West Georgia, and Jennie English, Development Director of Rapha Clinic of University of West Georgia, excuse me. And we're also on Facebook Live. Before we get into more details about the Rapha Clinic, because we're going to run out of time, and I want to get this in.
Mm.
Tell us a little something about the word Rapha, what
Yeah.
the ministry of it all, the faith-based aspect
Well,
of it.
Thank you. It's the Hebrew word meaning to heal and restore. In fact, one of the names for God is Jehovah Rapha, the God who heals. And as you know, Sue Brockman, who founded it, had a passion to have something in the community where people, if you've ever been caught without insurance, if you've ever gone a long time without health care, you get really sick. And I've had the pleasure of talking to patients and the life-changing stories they tell me. In fact, we're going to have a patient testimony at the Sound of Medicine event. But it's hard to understand the anguish that people feel when they can't afford it. They just can't afford it. They don't know what they're going to do, and then they find us. And we've got room for more. And so I do want to let everybody know there is a process. Everybody that comes through has to go through a financial screening process. And really a lot of that is that the pharmaceutical companies that we work with require that, because we gave away almost $1 million of medication last year at no charge.
And now you get that donated through the pharmacies.
Yes, well,
Or
yes. There are
pharmaceutical
programs through the pharmaceutical
pharmaceutical
companies,
companies.
and we do some, you can go and get a generic for $4, whatever, but there's a
Right.
lot of life-saving medicine that goes out those doors. And so, we have a website, raphaclinic.org, that has the procedure. So people do have to, the first step is they need to call the clinic, 770-562-4501, and they'll come in for a financial screening, and then we start out with lab work to really see where people are, and then we have 2 nurse practitioners. Thank you, Tanner, and thank you, Georgia Baptist Healthcare Foundation. And we have a staff of about 10 folks and lots of volunteers, volunteer physicians, volunteer dentists. Dr. Bill Calhoun here is our dental director. And we have volunteer hygienists, but it takes a lot of folks to make this happen.
Mm-hmm. Yeah, where are your locations?
Well, we're in Temple at 253 East Highway 78, and then in Bowden at 345 Bar Industrial Avenue. But just call us and we'll make it happen. We don't want anybody to go without health care.
But what counties do you serve? You serve more than Carroll.
Carroll, Haralson, Heard, Paulding, and Douglas.
5 counties.
Yes, sir.
That's a lot.
It is. It is.
Okay.
Yeah.
All right, and let's before we run out of time, let's go over our events again. First with Jacob, we got the 5K walk. This is not a run. This is a walk, right?
Well, you can either run or walk. And we do have medals we give out every year. So if you want to be competitive, you can definitely run if you would like. But if you're unable to or just don't want to,
This
you're
is
more
not
than
like
welcome
one
to
of
run.
those crazy Peachtree qualifiers.
No, absolutely not.
Those things are crazy.
You and I will be walking.
Well, we'll be struggling. I'm not sure we can even walk. We'll be, bring my walker. And
There you go.
We'll, get through it. Tell us again when and where that is.
It's going to be April 14th at 11 a.m. On the Greenbelt at Hobbs Farm. I would recommend you get there probably 30 minutes early at the minimum because it's going to be a long process to get everybody checked in and get everybody's numbers and let everybody sign their waivers. So if they have an accident or whatever while they're running, we're not liable. You got to be honest.
When I fall down, I won't sue.
No.
Okay. How much is the cost to register?
We will have where you can a website where you can register online beforehand. It'll be $15. If you wait till the day of, it will be $20.
Okay.
And I think it's something like the first 20 or 25 will get a shirt.
Really?
Mm-hmm.
Oh. Who like win?
No, the first 25 people that
Who
sign up.
register?
Mhm.
Well, I could probably compete in that.
He'll want a shirt. Okay.
Yeah. And your event Thursday.
Thursday night, 6:30 p.m., Milltown Music Hall. Got to call, though, and let us know. And I also want to say again, Tanner, I don't know where we would be without Tanner Health System. All the support they've given us is amazing. And also Greenway Health.
Mm-hmm.
They've been a huge, huge supporter of ours. And like I said, we've got 31 sponsors. And this money is going to go toward helping people get well and stay well and be productive in our communities.
And give me your phone number, so because if they want to get in touch with Jacob, probably
Yeah.
the best thing to do is
Yeah.
call you also.
Yep, 678-953-7877.
Now you've got tell us a little something as we wrap up. Tell us a little something about the nonprofit world as it relates to Rapha. I mean, this is a big challenge. What y'all do?
Yes, well, like all nonprofits, we have a board, and there are right now 9 people on the board, and many of those folks have been with us for a long time because of their commitment. Dr. Eubanks, as I told you, she's been with us for a long time. Richard Tysinger Jr. Has also been there a long time, and Richard Meggs, and there's just Carolyn Henderson. Carolyn Henderson is on the board, and she used to meet at one of the churches in Villa Rica with the founder to pray when this was just a vision. I mean, they prayed for a very long time, and now it's a reality.
Yeah, and
Which
I'm sure you've seen many patients that have been blessed by this.
Oh my goodness! Let me tell you, I've had people tell me that their lives have been saved and changed, and that's the thing I enjoy most about it when I come, when I'm there, is getting to hear those patient stories. They're real.
And I guess they're all walks of life in a sense, and that
There are people who work, and then people who are not able to work, and a lot of people have just kind of fallen through the cracks and they don't have access to the insurance or whatever. So you see everybody, but everybody makes it work.
Mm-hmm.
And for some people who come and maybe don't even have family, we've really become their family. Oh, and very important, we have prayer ministers.
Mm-hmm.
Right now we have 3 people, and one of them, Miss Francis, has just turned 86. She's been there also almost from the beginning. And when people come in, we offer to pray with them. When you're sick, that's so comforting. And then there is the offer to learn about the gospel. And no one is ever required. It's never a requirement that you have to be prayed for or hear the gospel or whatever, but it's an offer. And this year, 3 people did make a decision to follow Christ. And that's so exciting. And one will be giving her testimony at the event.
This Thursday, beginning at
6:30 at Fabulous Milltown Music Hall.
Yeah, it's where Steve Bennett is director or general whatever manager.
Yes, he is. Yes, he is.
Will he be there? Will he be there? We don't know.
He's playing drums with Dr. Seaman's group. And let me tell you something, he's really, really good.
Is he really?
He's very good. Very good drummer, yes.
And Carroll County Community Wind Ensemble will be present.
You know about them, don't you?
I've heard about them.
Are you on their board?
Something like that.
Yeah.
Something like
that. And let's also, Jacob and I are both Bremen High graduates, so just a shout out, 1969 and
2013.
Wow, that's a lot of difference.
The generations working together.
How many generations difference?
I don't know. I did get the math word, but I can't subtract that.
Well, we're out of time.
Do we get to come back again?
We'll talk about it. And your phone number again?
678-953-7877. And I want to thank you, Steve, for all you do for the community.
I just talk a lot. That's it. Thank you, Jacob. I appreciate you, and we salute what you and your colleagues do with the emerging healthcare leaders of West Georgia. And Jennie English, it's always a delight.
Always.
All right, thank you for listening to the Community Voice here on WLBB Carrollton.